Cynical Therapies, Perspectives on the Anti-Therapeutic Nature of Critical Social Justice. A new book edited by writer and psychotherapist Dr. Val Thomas sets out the apparent activist turn that professional psychotherapy has taken in recent years. It details that therapy has come to be shaped by critical social justice ideology and is no longer a client-centred, politically neutral practice. So to speak about this in more detail, I'm delighted to welcome clinical psychologist Dr. Carole Sherwood and psychotherapist Ben Harris. Thank you both for joining us. So, Carole, I'm going to come to you first. Can you just describe, this is an interesting book. It combines many different authors and perspectives on this problem, a problem that a lot of people won't even understand exists.
Yeah, that's very true, Andrew, and that's why I'm really glad we've had the opportunity to come and talk to you and your viewers and listeners tonight. I think there can't be many areas of life that aren't touched by critical social justice ideology, and therapy is no exception. And this is a worry, because people who seek help from a therapist are generally at a low ebb. They're distressed, they may have anxiety or depression, and what they need is somebody who's prepared to treat them as a unique individual, to actually sit with them, to be compassionate and non-judgmental. But what we're getting now are activist therapists, and activist therapists have a political agenda. They want to impose their political views on their clients. So if you come along to see one of these activist therapists, what they will do is, rather than treat you as a unique individual, they will categorise you as a member of a majority group or a member of a minority group.
So that's something we should clarify, is that what we call critical social justice, more colloquially known as wokeism. We're talking about a mindset that sees everyone, first and foremost, in terms of group identity rather than individual. And surely, when it comes to therapy, the individual is surely what matters most.
You would think so, and indeed it has been for many years, even from the time of Freud. But now, because this is a political endeavour, the therapists who are meant to be helping the individual are actually trying to change society. It's like a form of social engineering. And so what they will do is, if they label you as a privileged person, then they will give you a moral re-education. They'll tell you you're racist, or you're a member of the patriarchy, and this has to change. Or if you're perceived as a member of an oppressed group, a minority, then you'll be guided towards political activism yourself.
Now, this is very interesting, and I'm going to bring Ben in on this, because we've seen this in many fields, particularly academia, but even in secondary education, even primary education, where activists become teachers, and then they will teach the children that if they are white, they are complicit in white supremacy, whether they like it or not, etc. Things like this. A very simplistic, reductive worldview. But it's in therapy. You know, people have been surprised that it's come into medicine in that area at all, but therapy?
Well, that's right, isn't it? I mean, therapy, one might traditionally think of it as being a very nuanced activity, very nuanced practice that, as Carole says, thinks about individuals. What we're really seeing, I think, is a tragedy. I don't think it's unfair to use that word. You know, maybe you could find a way to think about critical theory in a more nuanced way, but quite often the way it's used is it sort of destroys the traditional understanding that therapeutic modalities have built up. Decolonisation breaks down in the training institutes the ideas that therapy is made of, and it replaces it with this, what I think of as this very flat way of thinking about things. So there are black and white ideas, good and bad people. Therapy traditionally, when you come to therapy, it's about recognising responsibility, that you've got some role in the problems that you've got, that the world is grey, that it's not black and white.
So you can't do that if the person diagnosing you or treating you divides you into either an oppressed or an oppressor class.
Absolutely right. And, you know, maybe your audience, people at home, might want to think about what is it that is meaningful for them in life. I mean, for most people, I'm pretty sure it's not political activism. And what this seeks to do is to say that you've got to think about yourself in terms of these oppressor and oppressed classes, and then you've got to do something about it. Therapy is about healing and growth. That's what it should be about, right? It's not about telling people how they need to focus their life, telling they need to be activists. But unfortunately, this tragedy that is happening is that the therapists who are convinced by this, they become their own kind of form of moral narcissists. They impose their values on their clients. you know, when I was trained, it was absolutely clear that's not what you're doing as a therapist. Right?
No, I mean, surely a therapist who is effectively trying to recruit for an activist cause is effectively blaming the patient for their privilege and saying they need to proactively go out into society and change it for the better.
Exactly.
Can that person really be said to be a therapist at all?
No, not at all. And that's why we've called this book Perspectives on the Anti-Therapeutic Nature of Critical Social Justice. It's not therapy.
Can I just ask, though, is this just the case that lots of activists have come into the profession and they now dominate? Or has it come from those who are training the therapists? Has it come... are the roots a bit more deeper?
Yeah, that's an interesting question. I think it comes from several different sources. Yes, there are activists who wish to become therapists. So it's a grassroots movement amongst some young people who want to be activist therapists. But also there are governmental organisations like NHS Health Education England who are imposing anti-racism, as it's so called, and decolonisation on clinical psychology training courses.
And we should probably clarify that, because anti-racism sounds great because we're all against racism, but that's not what it means, is it?
No, it isn't what it means. And it's critical race theory. And it was interesting. I heard you talking earlier about Diane Abbott's letter. That is an example of critical race theory in action. Because
Can you explain that?
Yes, sure. Because what it is saying is that however disadvantaged a white person may be, they are incapable of experiencing racism because of the colour of their skin.
So we can see how that kind of approach, that critical race theorist approach, actually generates a hyper-racialised, divisive worldview. And this is important, isn't it, Ben? Because one of the main tenets of critical race theory and anti-racism is you have to be proactively anti-racist. It's not good enough not to be racist. You have to stop others from being racist. You have to detect it, often where it isn't. You know, so this has got nothing to do with therapy, surely.
Well, that's right. And, of course, if you think about that idea of needing to detect it in other people and then sort of neutralise it or fix them, then you're setting up a kind of paradigm around power, which is, of course, what they're interested in. They say that power lies elsewhere and they're trying to rectify things. But if you're trying to tell your client how to fix themselves in this sort of morally determinative way, you're imposing your power on your client.
But surely there are lots of therapists who aren't going along with this and who are actually doing a very good job. And so what's the extent of this?
Well, that's hard to tell, and that's because people have been quite quiet about this. It's why this book is very important, because it's really the first sort of organised coming together of a group of highly experienced practitioners, clinical psychologists, psychotherapists, academics, to talk about this, to offer differing critiques of what's going on, different ways of analysing it. We are starting to see a bit of pushback in the journals as well. There was a paper in the European Journal of Psychotherapy recently questioning from a different angle than one I would take, but starting to talk about these questions. So what we're starting to see is a little bit more of people sort of piping up a bit. And that's what we want to encourage. Carole and I want to encourage colleagues to start to think about this and start to talk about it, to understand that what appears to be a sort of very simple positive thing on the surface, actually, like everything else in life, it has drawbacks, right? We need to be aware that anything that you push has a dark side as well as a light side.
And this is difficult, isn't it? Because whenever this ideology infects any particular institution, it's quite unforgiving to those who don't go along with it. And that surely means that it is going to get worse and worse in therapy.
I think that's right. And, I mean, you've seen examples. There's Amy Gallagher and there's James Esses, both excellent psychotherapy trainees who have been thrown out of their training courses because they've dared to express a view that doesn't accord with
Well, Amy Gallagher was on this show and, you know, she was thrown off her course because she refused to confess to her racism because she says, I'm not racist.
Yes.
Right? So what on earth has that got to do with training to be a therapist?
Well, I think this is what we're asking in the book. It hasn't got
this weird kind of struggle session where you've got to confess to something you didn't know you were guilty of.
Exactly. And if you see that's happening to trainees, just imagine what it's going to be like when you're actually seeing patients.
Yes, very scary stuff. Well, this is, it's called Cynical Therapies, edited by Dr. Val Thomas. It's a fascinating book. You should check that out. Thank you, Carole and Ben, for coming onto the show. Really appreciate it.